Hi guys, so welcome to the masterclass on post burns neck contractures. As we all know, in this talk we will be discussing about anesthesia for post burns contractures. We will be discussing it more from the plastic surgeon's point of view rather than the anesthetist point of view. We'll just touch and go the important aspects which are concerned, which we as plastic surgeons should be aware of. If we try to understand the problem of post-burns neck contracture, the reported incidence of difficult intubation is around 6% or so, 5.85%. Cannot actually intubate situation is around 0.35%. Cannot ventilate, cannot intubate situation is around 0.02%. This is very tricky, and all these things can be major causes of anesthesia related morbidity and mortality. So PBC neck, post-burns contracture neck, is never to be taken lightly. These can cause problems at any point of time. As plastic surgeons, we already know what the actual challenge is. But let us try to understand the challenge from anesthesia point of view. So in this particular patient, you can see that there is reduced submandibular space compliance due to the extensive scarring and extensive fibrosis in that particular area. It is difficult for the anesthetist to maneuver through that particular area. There is obviously, we can appreciate that there is limited atlanto-occipital joint extension, whereby neck extension is not possible and intubation is going to be difficult. In this case, as well as in other severe cases, there can be fixed flexion deformity of the neck, and when the burns involves the neck, very commonly the nares are affected. There can be fibrosis of the nose, there can be deviation of the angle of mouth, there can be microstomia. So all these problems compound together and increase the challenge which is faced by the anesthetist. Coming to some more challenges, as we just discussed, there can be restricted mouth opening, as is seen in this particular patient. Because of the extrinsic contracture, the lip is everted, the mouth opening is limited, and understandably anesthesia is going to be a problem. There is also decreased oropharyngeal space because of the contracture. If contracture is specifically